Have you ever wondered what you'd do if a stroke or heart attack struck while you were completely alone? For seniors, this scenario can feel overwhelming, but the truth is, you have the power to take control and save your own life. In this video, we're sharing 5 critical, life-saving tips tailored for those over 60, designed to empower you with simple, practical actions to survive a medical emergency when help isn't immediately available. You need to watch until the end because these clear, easy-to-remember strategies could be the difference between life and death, giving you the confidence and tools to act fast and protect your future. Before we begin, I would appreciate it if you like this video. You can help me continue to spread the old age lesson. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. If you like this video, please comment number 1. If you don't like it, comment number 0 to let me know, so I can make a better video for you. Now let's get started. Number 1. Recognizing the warning signs and acting immediately. When it comes to surviving a stroke or heart attack, especially for seniors who may be alone, the single most critical factor is recognizing the warning signs and taking immediate action. Time is not just a factor. It's the defining element in determining whether you'll recover fully, suffer long-term damage, or, in the worst cases, not survive at all. Every second that passes without intervention increases the risk of irreversible damage to your brain or heart tissue. For strokes, brain cells begin dying within minutes of oxygen deprivation, and for heart attacks, heart muscle damage escalates rapidly without restored blood flow. Hesitation, denial, or dismissing symptoms as minor ailments like indigestion, fatigue, or even aging itself can cost you precious time that could mean the difference between life and death. Consider the story of James, a 73-year-old retired teacher living alone in a quiet suburban neighborhood. One morning, while sipping coffee and reading his newspaper, he noticed a sudden numbness in his face and a troubling weakness in his left arm. These symptoms came on abruptly, which is often how strokes announce themselves. Instead of brushing it off as a fleeting issue or assuming he was just tired, James trusted his instincts. He had attended a community health seminar a few months prior, where he learned about stroke symptoms using the FAST acronym: face drooping, arm weakness, speech difficulty, time to call emergency services. Recognizing these signs, he immediately dialed 911 and calmly explained his symptoms to the operator. While waiting for help, he sat down to avoid falling and stayed focused to remain calm. That swift, decisive action allowed paramedics to reach him quickly, administer clot-busting medication at the hospital, and facilitate a remarkable recovery. Today, James is back to enjoying his morning paper, thanks to his quick response. The importance of recognizing warning signs cannot be overstated. Strokes often present with sudden symptoms, such as numbness or weakness in the face, arm, or leg, particularly on one side of the body. Confusion, trouble speaking, or difficulty understanding others' speech. Vision problems, like sudden blurriness or loss of vision in one or both eyes. Difficulty walking, dizziness, or loss of balance and coordination. Severe headache with no apparent cause, sometimes described as the worst headache of one's life. Heart attacks, on the other hand, may manifest with chest discomfort, such as pressure, squeezing, fullness, or pain, which may come and go. Shortness of breath, often accompanied by a sense of unease. Pain or discomfort radiating to the arms, back, neck, jaw, or stomach. Cold sweats, nausea, or lightheadedness, sometimes mimicking indigestion. Unfortunately, many seniors downplay these symptoms, attributing them to less serious causes like stress, overexertion, or even aging itself. This tendency is particularly dangerous because it delays life-saving treatment. For instance, women may experience atypical heart attack symptoms, such as fatigue or jaw pain, which are often mistaken for something benign. Psychologically, fear of causing a fuss or embarrassment about potentially overreacting can paralyze decision-making. Denial also plays a role. Many hope the symptoms will simply go away. However, this hesitation can be catastrophic. To counter this, cultivating a survival mindset is essential. This means trusting your body's signals and prioritizing your health above concerns about inconvenience or embarrassment. It's a form of self-respect and empowerment, particularly for seniors who may face these emergencies alone. To prepare, educate yourself thoroughly on stroke and heart attack symptoms. Attend health workshops, read reliable medical resources, or consult your doctor to understand your personal risk factors. Memorize emergency numbers and keep them easily accessible, such as programmed into your phone or posted on your refrigerator. Consider a medical alert device, which can be a lifeline for seniors living alone. These wearable devices allow you to summon help with the press of a button, even if you're unable to reach a phone. Practice mental preparedness. Visualize how you would respond to sudden symptoms, reinforcing the habit of acting quickly rather than hesitating. This proactive approach transforms knowledge into action, ensuring you're ready to respond with confidence. The difference between calling for help at the first sign of trouble and waiting even a few minutes can profoundly impact the quality and length of your life. By embracing this mindset, you're not just preparing for an emergency, you're taking control of your health and future. If you are still watching this video and finding these lessons useful, please comment number 1 below to let me know that you are still watching this video with me. Thank you for your valuable time. Number 2. The power of self-help techniques when alone. Experiencing a stroke or heart attack while alone can feel overwhelming, with the isolation amplifying fear and uncertainty. However, you are not powerless in these critical moments. There are practical, life-saving self-help techniques that seniors can use to stabilize their condition while waiting for emergency responders. These techniques, when applied correctly, can buy precious time, protecting your heart and brain until professional help arrives. One of the most effective self-help methods is cough CPR, a lesser-known but potentially life-saving technique for maintaining blood flow during a heart attack. Let's look at the story of Helen, a 78-year-old grandmother who lived alone in a small apartment. One quiet afternoon, Helen felt a sudden, crushing pain in her chest, accompanied by dizziness and nausea, classic signs of a heart attack. Fortunately, she had attended a health seminar where she learned about cough CPR. Without hesitation, she began coughing forcefully and rhythmically every 1 to 2 seconds while reaching for her phone to dial 911. This steady, deliberate coughing helped maintain blood circulation and oxygen delivery, keeping her conscious until paramedics arrived. Her quick thinking and application of this technique were instrumental in her survival and eventual full recovery. CPR works by mimicking the heart's pumping action. When you cough forcefully, the pressure in your chest compresses the heart, helping it circulate blood and deliver oxygen to vital organs. This can be critical in the early minutes of a heart attack, when the heart may struggle to pump effectively. To perform cough CPR, cough deeply and forcefully every 1 to 2 seconds. Maintain a steady rhythm, as consistency is key to sustaining blood flow. Continue until help arrives or you feel your condition stabilize. While cough CPR is not a substitute for professional medical care, it can serve as a temporary measure to bridge the gap until paramedics take over. However, it's important to note that this technique is most relevant for heart attacks and should only be used by those who have been trained or advised by a medical professional. Always consult your doctor to ensure it's appropriate for your health profile. In addition to cough CPR, controlled breathing exercises can support your body during a crisis. Deep, slow breaths, inhaling for 4 seconds, holding for 4, and exhaling for 4, can increase oxygen intake, reduce panic, and stabilize your heart rate. This technique, often called box breathing, is particularly helpful for calming the nervous system and maintaining oxygen saturation when your heart or brain is under stress. Practicing these exercises regularly, even outside of emergencies, can make them second nature, ensuring you're prepared to use them effectively when needed. The psychological barrier to using self-help techniques is often self-doubt or fear of doing the wrong thing. Many seniors worry that attempting something like cough CPR might worsen their condition. However, the risk of inaction far outweighs the risk of trying. Training yourself to act decisively builds confidence and reduces panic in high-stakes moments. To prepare, learn the techniques through reputable sources, such as community health classes, online tutorials from trusted medical organizations, or discussions with your healthcare provider. Practice regularly. For example, rehearse the rhythm of cough CPR or box breathing during calm moments to build muscle memory. Visualize scenarios where you might need these techniques, mentally rehearsing your response to stay calm and focused. Helen's story illustrates the power of preparation. When her symptoms struck, she could have succumbed to panic or frozen in fear. Instead, her prior knowledge and mental readiness allowed her to act swiftly, using cough CPR to stabilize her condition while calling for help. This combination of practical action and emotional resilience kept her alive until paramedics arrived. The second life-saving tip, therefore, is to equip yourself with practical self-help techniques like cough CPR and controlled breathing, and to prepare mentally to use them with confidence. These skills don't require you to be a medical expert, just a proactive individual ready to take simple, effective actions to protect your life. By integrating these techniques into your preparedness plan, you significantly increase your chances of surviving and recovering from a stroke or heart attack, especially when alone. Number 3. The critical role of recognizing early warning signs. One of the greatest challenges seniors face during a stroke or heart attack, particularly when alone, is recognizing the early warning signs for health and the future, quickly and accurately. These conditions often strike suddenly, and their initial symptoms can be subtle or easily mistaken for less serious issues like fatigue, indigestion, or even normal aging. However, ignoring or misinterpreting these signs can lead to catastrophic delays in treatment, reducing the chances of survival or full recovery. Knowing what to look for, trusting your instincts, and acting decisively are your first lines of defense. Take the example of Carl, a 75-year-old retired teacher who lived alone in a rural area. One morning, while preparing breakfast, he felt an unusual tightness in his chest, accompanied by mild dizziness and a clammy sensation. These symptoms were subtle, not the dramatic, crushing pain he'd always associated with heart attacks. But Carl had attended a health workshop where he learned about the early warning signs of heart attacks and strokes. Instead of dismissing his discomfort as indigestion or overexertion, he sat down, took slow, deep breaths to stay calm, and called 911. His quick recognition of these signs and immediate action allowed paramedics to intervene early, administering life-saving treatment that led to a full recovery. The early warning signs of a stroke or heart attack can vary, but they often include, for a stroke, sudden numbness or weakness in the face, arm, or leg, especially on one side. Sudden confusion, difficulty speaking, or trouble understanding speech. Sudden vision problems, such as blurriness or loss of vision in one or both eyes. Sudden trouble walking, dizziness, or loss of balance. A sudden, severe headache with no apparent cause. For a heart attack, chest discomfort, such as pressure, squeezing, or pain, which may radiate to the arms, back, neck, jaw, or stomach. Shortness of breath, often with a sense of anxiety or unease. Cold sweats, nausea, or vomiting, sometimes mistaken for flu-like symptoms. Sudden fatigue or lightheadedness, particularly in women. These symptoms may be fleeting, mild, or intermittent, which is why they're often overlooked. For seniors with chronic conditions like arthritis, diabetes, or high blood pressure, distinguishing these warning signs from everyday aches or ailments can be especially challenging. This is where education and awareness become critical. Carl's story highlights the importance of knowing your body's baseline and recognizing when something feels off. Regular health checkups and open conversations with your doctor can help you understand your personal risk factors and identify what's normal for you. Keeping a symptom journal, tracking unusual sensations, their duration, and triggers, can also deepen your awareness of your body's signals. For example, noting occasional health and future. The FAST acronym for strokes or the common signs of a heart attack can make them a valuable ally in an emergency. The importance of immediate response cannot be overstated. Once you recognize a warning sign, call 911 immediately and describe your symptoms clearly. Don't wait to see if the symptoms worsen or resolve on their own. Every minute counts. Paramedics can begin life-saving interventions, such as administering oxygen or medications, even before you reach the hospital. Carl's decision to call for help at the first sign of trouble, rather than waiting, ensured he received timely treatment and avoided long-term damage. Seniors often worry about being a burden or causing unnecessary alarm. But when it comes to strokes and heart attacks, there's no such thing as overreacting. Your life is worth any temporary discomfort or inconvenience. To prepare, educate yourself deeply on the warning signs through reliable sources like the American Heart Association or local health programs. Discuss your risks with your doctor, especially if you have conditions like high blood pressure, diabetes, or a family history of heart disease or stroke. Trust your instincts. If something feels wrong, act on it, even if the symptoms seem mild. Keep emergency contacts accessible and consider a medical alert device for added security. The third life-saving tip is to arm yourself with a thorough understanding of the early warning signs of stroke and heart attack and to trust your instincts to act swiftly. This knowledge, combined with emotional and physical preparedness, is your most powerful tool for protecting your life when you're alone. By taking these steps, you're not just reacting to an emergency, you're proactively safeguarding your health and future. If you are still watching this video and finding these lessons useful, please comment number 2 below to let me know that you are still watching this video with me. Thank you for your valuable time. Number 4. The life-saving power of proper positioning and breathing techniques. When a stroke or heart attack strikes, particularly for seniors who may be alone, the way you position your body and manage your breathing can play a pivotal role in your survival and recovery. These actions are not mere stopgaps while waiting for emergency responders. They are proactive measures that can reduce strain on vital organs, improve oxygen flow, and help maintain calm in a high-stakes situation. For seniors, who may face unique challenges due to age-related conditions or limited mobility, mastering proper positioning and breathing techniques is an essential component of emergency preparedness. These strategies empower you to take control, stabilize your condition, and increase your chances of a positive outcome. Let's revisit Helen's story, a 78-year-old widow living alone in a small apartment. One afternoon, while tending to her plants, Helen suddenly felt a wave of dizziness and weakness in her left arm, early signs of a mild stroke. Panic could have easily taken over, but Helen had attended a community health seminar where she learned about the importance of positioning and breathing during a medical emergency. Instead of remaining standing or lying flat, she carefully sat down on a chair, leaned slightly forward with her elbows resting on her knees, and began taking slow, deliberate breaths. This position alleviated pressure on her lungs, making it easier to breathe, while the controlled breathing helped reduce her dizziness and kept her calm until paramedics arrived. Her quick thinking and application of these techniques were critical in stabilizing her condition, allowing her to communicate clearly with emergency responders and ultimately contributing to her full recovery. Why positioning matters. Proper body positioning during a stroke or heart attack can significantly influence how your body copes with the crisis. The goal is to reduce physical stress on the heart and brain, prevent complications like falls, and ensure adequate oxygen delivery to vital organs. Here's how positioning can help it: sitting upright or slightly forward. This position is particularly effective for heart attacks or situations involving shortness of breath. By sitting with your back straight or leaning slightly forward, you reduce pressure on the lungs and diaphragm, making it easier to breathe. This also minimizes strain on the heart, which may already be struggling to pump blood effectively. Resting your elbows on a surface, like your knees or a table, can further stabilize your posture and prevent exhaustion. Avoid lying flat. Lying flat on your back can worsen symptoms, especially if you're experiencing shortness of breath or fluid buildup in the lungs, which is common in heart attacks. For strokes, lying flat may increase intracranial pressure in some cases, exacerbating symptoms like dizziness or headache. However, if you feel faint or at risk of falling, lying down on your side, preferably the unaffected side in the case of a stroke, can prevent injury while keeping airways open. Preventing falls. Dizziness, weakness, or loss of coordination are common in strokes and heart attacks, increasing the risk of falls, which can lead to additional injuries like fractures or head trauma. If you feel unsteady, sit down immediately on a chair, couch, or the floor, or carefully lower yourself to a safe position to avoid falling. The role of breathing techniques. Breathing is more than just an automatic function. It's a powerful tool for managing a medical emergency. During a stroke or heart attack, oxygen delivery to the brain and heart is often compromised, and panic can exacerbate this by increasing heart rate and blood pressure. Controlled breathing techniques can counteract these effects by improving oxygen saturation, calming the nervous system, and reducing the body's demand for oxygen. Here's how to use breathing effectively. Box breathing. Inhale slowly through your nose for 4 seconds, hold your breath for 4 seconds, exhale gently through pursed lips for 4 seconds, and pause for 4 seconds before repeating. This technique, used by Helen, slows your heart rate, reduces panic, and ensures steady oxygen intake. Pursed lip breathing. Inhale through your nose for 2 seconds, then exhale slowly through pursed lips, as if blowing out a candle, for 4 to 6 seconds. This method is particularly helpful for heart attack symptoms like shortness of breath, as it helps regulate airflow and prevents hyperventilation. Diaphragmatic breathing. Place one hand on your chest and the other on your abdomen. Breathe deeply through your nose, ensuring your abdomen rises more than your chest, then exhale slowly. This engages the diaphragm, improving oxygen efficiency and reducing strain on the heart. The psychological benefits of these techniques are just as critical. A stroke or heart attack can trigger intense fear, leading to rapid, shallow breathing that worsens symptoms and clouds judgment. By focusing on slow, deliberate breaths and maintaining a stable position, you create a sense of control, which helps you stay calm and think clearly. This mental clarity is vital for taking additional steps, such as calling 911 or alerting a neighbor. Preparing for Actio, make these techniques second nature. Regular practice is essential. Seniors can integrate positioning and breathing exercises into their daily routines to build confidence and muscle memory. For example, practice positioning. Sit in a chair and rehearse leaning slightly forward with elbows supported, noting how it feels to breathe in this posture. Practice transitioning safely from standing to sitting or lying down to prepare for moments of dizziness or weakness. Incorporate breathing exercises. Dedicate 5 minutes daily to box breathing or pursed lip breathing. This not only prepares you for emergencies but also improves overall lung capacity and stress management. Simulate emergencies. Mentally rehearse how you would respond if symptoms struck. Visualize yourself sitting down, adjusting your posture, and breathing slowly while reaching for your phone. This mental preparation reduces hesitation in a real crisis. Additionally, ensure you have easy access to communication tools. Keep a phone within reach at all times, ideally with emergency numbers programmed for speed dialing. A medical alert device, worn as a bracelet or necklace, can be a lifesaver if you're unable to reach a phone. Sharing your preparedness plan with trusted neighbors or family members can also ensure faster assistance if you're incapacitated. Helen's experience underscores the power of these simple yet effective strategies. By sitting down, adjusting her posture, and using controlled breathing, she not only managed her symptoms but also maintained the composure needed to call 911. These actions bought her critical time, allowing paramedics to intervene before her condition worsened. While these techniques are not substitutes for professional medical care, they are vital first steps that can stabilize your condition, reduce complications, and improve your chances of survival. The fourth life-saving tip is to master proper positioning and breathing techniques and practice them regularly to ensure they become instinctive. These tools empower you to take control during a medical emergency, even when alone, providing both physical and psychological support until help arrives. By preparing proactively, you're equipping yourself with the skills to navigate some of life's most challenging moments. If you're finding these insights valuable, please comment number 4 below to let me know you're engaged. And if you haven't subscribed yet, I encourage you to subscribe and turn on notifications to stay updated with life-saving tips like these. Your support helps us continue creating content to inform and empower you. If you are still watching this video and finding these lessons useful, please comment number 3 below to let me know that you are still watching this video with me. Thank you for your valuable time. Number 5. The critical importance of recognizing early warning signs and acting. When a stroke or heart attack strikes, time is not just a factor, it's the currency of survival. For seniors, who may be more vulnerable to these conditions and often live alone, recognizing the early warning signs and acting immediately can mean the difference between life and death, or between a full recovery and lasting disability. The ability to identify symptoms quickly and respond without hesitation is a cornerstone of emergency preparedness, particularly when medical help is not immediately available. Consider the story of Robert, a 72-year-old retired mechanic living alone in a quiet neighborhood. One morning, while reading in his armchair, Robert noticed an unusual wave of fatigue, followed by mild chest discomfort and a slight ache in his left arm. These symptoms were subtle, not the dramatic chest pain he'd seen portrayed in movies. However, Robert had recently read an article about heart attack symptoms in a health magazine and recognized that his symptoms were cause for concern. Instead of waiting to see if they would pass, he immediately called 911, described his symptoms clearly, and sat down to avoid exerting himself. Paramedics arrived within minutes, and doctors later confirmed that his quick action allowed them to administer a stent procedure that minimized heart damage and saved his life. Robert's story illustrates the power of awareness and decisive action in the face of a medical emergency. Understanding the early warning signs of a stroke or heart attack can vary in intensity and presentation, but they are always urgent. For a heart attack, common symptoms include chest pain or discomfort, often described as pressure, squeezing, fullness, or a burning sensation, which may come and go or persist. Pain radiating to the arms, especially the left arm, neck, jaw, back, or stomach. Shortness of breath, sometimes accompanied by a sense of anxiety or impending doom. Nausea, vomiting, or indigestion-like symptoms, particularly in women. Cold sweats, lightheadedness, or sudden fatigue can be subtle but significant. For a stroke, key indicators include sudden numbness or weakness in the face, arm, or leg, typically on one side of the body. Sudden confusion, difficulty speaking, or trouble understanding speech. Sudden vision problems, such as blurriness, double vision, or loss of vision in one or both eyes. Sudden difficulty walking, dizziness, loss of balance, or coordination issues. Sudden severe headache, often with no known cause, sometimes accompanied by nausea or vomiting. These symptoms may appear suddenly or develop gradually, and they can be fleeting or intermittent, which makes them easy to dismiss. Seniors, in particular, may attribute these signs to aging, chronic conditions like arthritis, or even stress. For example, mild chest discomfort might be mistaken for heartburn, or arm weakness might be shrugged off as muscle fatigue. This mindset can be deadly, as delays in seeking help reduce the effectiveness of life-saving treatments like clot-busting drugs for strokes or angioplasty for heart attacks, which are most effective within the first few hours of symptom onset. The stakes of delay: every minute counts during a stroke or heart attack. For strokes, brain cells die at a rate of approximately 1.9 million per minute when blood flow is interrupted, leading to potential loss of speech, mobility, or cognitive function. For heart attacks, prolonged oxygen deprivation causes irreversible damage to the heart muscle, increasing the risk of heart failure or death. The golden hour concept, seeking treatment within the first hour of symptoms, greatly improves outcomes, but even beyond that window, faster action correlates with better recovery. Seniors living alone face additional challenges, as there may be no one to notice symptoms or call for help. This underscores the need for a clear, proactive plan to keep emergency numbers accessible. Program 911 and trusted contacts into your phone's speed dial, or keep a list posted in an easily visible location, such as on your refrigerator. Use a medical alert device. These devices allow you to summon help with a single button press, even if you can't reach a phone. Inform neighbors or family. Share your emergency plan with trusted individuals who can check on you or respond if you activate an alert. Practice clear communication. When calling 911, describe your symptoms precisely, e.g., "I'm feeling chest pressure and shortness of breath," and mention any relevant medical history, e.g., "I have high blood pressure." Overcoming psychological barriers: fear, denial, and embarrassment are powerful psychological barriers that can delay action. Many seniors hesitate to call for help, worrying they'll be seen as overreacting or burdening others. This reluctance is particularly common among those who value independence or fear being perceived as frail. However, recognizing that seeking help is a sign of strength, not weakness, can shift this mindset. Education plays a critical role in overcoming these barriers. By learning to identify symptoms and understanding their urgency, you can move from doubt to action. To build this preparedness, educate yourself. Attend community health workshops, read materials from trusted sources like the American Heart Association, or watch videos about stroke and heart attack symptoms. Discuss risks with your doctor. Regular checkups can help you understand your personal risk factors, such as high blood pressure, diabetes, or a family history of cardiovascular disease. Keep a symptom journal. Track unusual sensations, their frequency, and duration to better distinguish normal aches from warning signs. Share knowledge. Teach friends, family, or caregivers about stroke and heart attack symptoms, using tools like the FAST acronym for strokes. This creates a support network that can act on your behalf if needed. Robert's experience highlights the life-saving impact of this approach. By recognizing his symptoms and acting immediately, he avoided the temptation to wait and see, which could have led to severe heart damage. His prior education and willingness to trust his instincts empowered him to take control, even in a moment of uncertainty. The fifth life-saving tip is to educate yourself thoroughly on the early warning signs of stroke and heart attack and commit to acting immediately when they appear. This knowledge, combined with a proactive plan and emotional readiness, is your strongest defense against the unpredictable. By preparing to recognize and respond to your body's signals, you're not just reacting to an emergency, you're taking charge of your health and future. Thank you for watching this life-saving guide on surviving a stroke or heart attack, especially for those over 60 facing these emergencies alone. We've covered critical tips to empower you with the knowledge and confidence to act fast and protect your life. Now, we'd love to hear from you. What's one key thing you've learned today that you'll put into practice? Please share it in the comments below to inspire others and build a supportive community. If you found this video helpful, please leave your comment below, and don't forget to like, share, and subscribe to our YouTube channel for more content that informs and empowers you to stay safe and prepared. Stay strong, stay informed, and we'll see you in the next video.